typically bypass surgery is for people that have extensive disease on all the arteries of the heart or the left main coronary artery. And it's also preferred in people that have poor heart function, and also diabetics tend to do better long-term with bypass surgery than other alternatives. Again, each case is different sometimes, and sometimes patients are actually evaluated by cardiology and cardiac surgery, and we'll work as a team to determine what the best plan is for each patient. The safety of the procedure has improved over years. The basic tenets of the procedure are unchanged actually since heart surgery was started in the late 60s and early 70s. We basically take, it's sort of a simple plumbing problem, and you have arteries that are clogged with atherosclerosis, and we take new vessels and connect them to the arteries past where the blockages are. We use arteries and veins from the other areas of the body in order to do that with. Basically, the procedure is still one where we make an incision in the sternum using the heart-lung machine in most cases, then do bypasses on the hearts. There are other, again, times where we may not use a heart-lung machine, but the standard operation in the country is through what we call median sternotomy with use of the heart-lung machine and then multiple bypasses. Well, the procedure is relatively lengthy for some, according to some procedures. It takes about 3 or 4 hours for the surgeon to do what he does typically. Sometimes it may be less than that, sometimes more. There's a big team involved in doing this operation. An anesthesiologist that specializes in this type of work takes care of the patient. We have a big team, so just the preparation of the patient takes a couple of hours, and then moving the patient back to the intensive care unit, and after surgery takes a while as well. So for the families that's waiting, if I say it takes 3 or 4 hours for the surgeon to do what he does, to them it'll be more like 6 or 7 hours from the time that the patient goes to the operating room until they're back into the recovery room. Patients do go to the intensive care unit after surgery. Can be there on varying lengths of time, but most patients are taken off the breathing machine the day of surgery or the next day, and typically patients are ready to go to a progressive care bed usually within 24 or 48 hours after surgery. The typical stay after heart surgery is about a week, maybe a little bit less than that. Most patients have limited activity for a few weeks after surgery, but by 8 to 10, 12 weeks typically can get back into a regular routine.